All right, guys, so I'm going to be doing a live today with Dr. Jennica. Let's see. Let me just invite her. All right, 1 second while I invite Dr. Jennica to go live. So, just an invite. You are so fast.
Hi there.
Hi, how are you?
Good. Thanks for having me tonight.
Yeah, so excited to see you. So many people are excited because you are a psychologist, but you're a neuropsychologist, which is a bit different than what I do. So we're going to be chatting about kind of a hodgepodge of things tonight. um,
Well, there's certainly a lot to discuss.
there is. So could you start off by telling us a little bit about who you are and what you do?
Yeah. So I'm Dr. Jennica Engler. I am a licensed psychologist in the Commonwealth of Massachusetts, and I also am a trained developmental neuropsychologist. So basically, what that means is that I did an extra 2 years of a fellowship in pediatric neuropsychology. My main focus was actually on the assessment and diagnosis of autism and other neurodevelopmental disorders in very young children. So think like young toddlers, young school age kids, and then, some teens and stuff like that as well for older guys.
That's amazing. So, as if like grad school for psychology isn't long enough, if you're a neuropsychologist, you have to do even extra school to get like certified or it's to get
Yeah.
like your board certification, correct?
Yeah, so you can elect to get the board certification, but that's like another exam and another thing. So I didn't actually get board certified because you don't need to be board certified in my state to be a neuropsychologist. You just need the additional years of training and experience. Although I'm sure in the future there will be a push for all neuropsychologists to be board certified, and I'll have to go back and study and take that exam. But I'll wait until that's required.
I would too. I haven't gotten the board certification in child psychology just because there's not really a reason for me to at this point. I mean, it doesn't add anything extra, to be honest, as far as training wise, I would say. So, yeah.
It's just another feather in your cap, as I like to say.
Exactly. Yes. So, you do lots of great work like with neuropsychology. So, one thing we were going to talk about is just like executive functioning
Yeah.
in general. So, can you tell me like what your take is on executive functioning and ADHD and just in general?
Yeah. So executive function is like one of those big buzzwords that everybody kind of knows about, but nobody actually really understands it because it's just kind of thrown about. And a lot of people, kind of, there's obviously a lot of overlap between ADHD and executive dysfunction. So what happens essentially is, something is awry with your executive functioning when it comes to ADHD. But I'll kind of take you through what it is, and we'll kind of be able to kind of circle back. So when you think about executive functions, it's really thinking about what happens in the frontal lobe. So my big noggin here, the frontal lobe is the last part of the brain that forms. It's also part of the forebrain up here. So it's, really up at the forefront of your brain. And it's something that is the last part of the brain to develop. So when people say the brain is not fully formed until age 25, that's actually the executive functioning areas that they're talking about mainly, because those sorts of things are not, kind of fully formed in the brain until, later points in development. So even though you're technically an adult at age 18, your brain is still developing its executive functions. So now, when we think executive functions and we think ADHD, really a lot of the issues with ADHD are those goal-directed activities. So like the goal-directed activities, and then also you have the emotional and impulse control. That's kind of what goes into some of the ADHD sort of issues when it comes to executive functioning. So when you think of executive functions, I want you to think like the readiness and ability to organize, initiate, sustain, and finish things. In order to do that, it requires other executive functioning skills. And I can definitely go back and define some of these if they're not super obvious. But the biggest one I want to focus on today is actually something called inhibition. So inhibition is essentially the ability to inhibit or to control one's impulses, or to control how you respond to external stimuli. So, right, like, dogs barking in the other room, and I'm going to inhibit my tendency to get distracted and look, right? Like, I'm going to focus and stay on task here despite what's going on. So there's a few different kinds of inhibition. That's a really big one when it comes to executive dysfunction and executive functioning in general. Another part of executive functioning is called self-monitoring skills. So this is like work checking yourself to make sure that you're on task, things like that, like kind of, really monitoring, where you're at and where you're going. Other things that go along with executive functionings are working memory. So in layperson's terms, that's really like your short-term memory, right? So we're not talking about things from a long time ago when you were a kid, or memory for dates, places, times. We're talking like, honey asked you to go to the grocery store and pick up 5 things. What are those 5 things? And are you coming back with those 5 things, or are you forgetting and bringing back other stuff? Mm-hmm. Other things that kind of go along with executive functions are initiation and motivation. And that can kind of range in ADHD from like not knowing how to get started, and decision-making issues like indecisiveness is, really a hard kind of thing for not just ADHD, but other things that kind of overlap with ADHD. Because, an inability to make decisions, difficulties with attention, that's something that's shared across many different sort of diagnostic categories of people, from people with depression and anxiety as well.
Yeah. And with that, it's like executive functions, it's talked about a lot with ADHD, but it's not exclusive to ADHD.
No. My rule of thumb is that if you didn't have the problems when you were early in the developmental period, so in other words, from grade school up and through high school, if these are only attention issues that happen to you as an adult, chances are it's actually not ADHD. Chances are those issues are secondary to things like depression, anxiety, trauma, PTSD, other things. With the caveat that a lot of people, especially women, are not formally diagnosed until later. But 2 separate things, right? Like, if it didn't happen, chances are it's not ADHD. If it was happening and causing problems, but you kind of skated by because you're, a female, you had all these, great, kind of coping skills and things that masked the difficulties and supports, totally different.
Yeah, I completely agree. It's like there's that developmental trajectory that you see with ADHD a lot, and there are often those challenges that you see when kids are young, even if they are not like diagnosed when they're young, but like difficulties with attention, they don't just pop up out of nowhere for sure.
Yeah.
So like, as far as like with like the brain, ADHD is definitely like a brain-based disorder. It's a neurodevelopmental disorder. So aside from the executive functioning, all those being in the front piece, are there any other important pieces about the brain with ADHD that you think would be helpful for everyone listening to know?
Yeah, so I want you to kind of think as executive functioning as like the underlying lens from which all of your other higher level cognitive abilities kind of shine through. When I say cognitive abilities, that's like your ability to think and problem solve and reason. So, for example, executive functioning essentially overlies everything else that's happening in your brain processes. It's so intrinsically connected with things like your memory and learning, because you need to be able to, attend what you're learning to while shutting out those external distractors. You got to modulate your emotional responses, make sure that, you're fully present for learning. And, your executive functioning is impacted by other external factors as well. So it's not just the brain, it's things like getting enough sleep and adequate nutrition, and then also substance use, right? Like the most commonly used substance in the world is caffeine, which people don't even think about as a substance. So that's like one of the stimulants that essentially helps or can for some people help the ADHD brain. So the biggest takeaway from brain-based functioning and executive functioning and ADHD that I kind of want the takeaway to be from this is that the way that our brain works is it's essentially acting like a bunch of interconnected neural networks. So basically, there's a use it or lose it kind of rule, and that's the basis for how our brains change over time. It's something called like the concept of neuroplasticity, which basically means throughout your life, even though your brain is mostly fully developed, it's always constantly doing like yard work essentially, right? So, if you don't use it, those neural pathways, they're getting pruned. If you use it and you use it frequently, that pathway is getting stronger. It's more likely to become more automatic. And that's like something that plays into account for things like anxiety or depressive disorders, where you get a lot of that rumination, like the negative thought cycle loops and things like that, because that's actually neuroplasticity happening, but in a negative way, because you're getting wired into those sort of negative maladaptive thought patterns. So yeah. The brain, it's a remarkable thing. It's always changing. But essentially what happens is so there's just some newer research that came out that's pointing to ADHD as essentially being like a connectivity issue between the brain. The dopamine system is kind of implicated in all this, as it is with a lot of other mental health conditions as well. But essentially what happens is it's almost like the ADHD brain has kind of spotty Wi-Fi. So like at times you're, hyper focused in on one thing, and then it's so scattered the other times because, things are kind of misfiring and the connections just aren't really happening as well as, they would in more of a neurotypically developing brain.
Yeah, the spotty Wi-Fi metaphor is such an interesting way to think about it, because that really, I think speaks to me and a lot of parents and how they can view their ADHD, because so often parents, they'll tell me, well, she or he, they can really focus on video games. So they can't have ADHD. And so then, I think explain it to them as it's like that spotty Wi-Fi where sometimes the signal is super strong with their attention. That's helpful. But then other times the Wi-Fi goes out while they're doing their work, and it's going to be out for a while. So I absolutely love that. And that's also why a lot of the medications help, because they work on those pieces of the brain.
Yeah, and that's actually one of the main questions that I get from parents. It seems kind of counterintuitive, right? You give a stimulant to a hyperactive kid. Wouldn't that make them more stimulated, right? Mm-hmm. And so that's where it kind of comes back to that concept of inhibition. So what's happening in the ADHD brain is that the dysfunction of the frontal lobes, it's resulting in disinhibited motor and thought activity. So like a high activity level because the brain isn't stopping those impulses, right? And what happens is that stimulant meds will stimulate the frontal lobes, and it's going to improve your motor inhibition. Basically, it's going to improve your impulse control, which then has the effect of decreasing the cognitive and motor high activity levels often associated with hyperactivity. So that's also why if you give a stimulant to somebody who's not ADHD, that brings them up, right? Because their brain is already inhibiting those sort of things, and it's not necessary to have extra. But in the ADHD brain, because of the dopamine kind of dysfunction in the brain, you actually need that just to get to a normal kind of baseline level of inhibition, which will allow you to kind of control your impulses and focus your attention.
I love the theory of under arousal with ADHD, because I think it's super interesting for parents. So we've only got a few minutes left, so I want to make sure we can talk about some tips for parents. So one question we got a lot is about when is the right time to go to a doctor if you think your child has issues with attention or executive functioning. So what do you think is the right time?
So I think as soon as you are worried or have problems is a good time to check with your pediatrician. They're really the gatekeeper. And, keeping in mind that the earlier you get intervention, the better the outcomes generally for almost all neurodevelopmental conditions, because especially, in my case, for really young kiddos, we're not necessarily diagnosing ADHD because you don't diagnose ADHD until, they're a little bit older in school age, right? Because you have to have issues in both settings, and developmentally it's pretty normal to have a young kid who has a lot of energy and not to be focused. It's not a realistic goal to have young older toddlers or young school age kids sitting quietly and staying on task all the time. That's not really normal, in fact. So what I would say is that if you have concerns about a high activity level and there are other developmental delays, I would seek, out a neurodevelopmental assessment and consult with your pediatrician sooner, as soon as you're noticing issues. And that could be even when, they're as young as age 2 or 3, getting them into early intervention before age 3. If they're after that, what I would say is, check in with your pediatrician. If there are behavioral concerns, there are, trained psychologists out there who can help, because usually it is actually behavioral parental behavioral sort of interventions that are the first sort of intervention that you would use in that sort of situation. You don't necessarily hop right to medications.
Yeah.
So, parent training and therapy for impulse control can be done really at any time.
And also for like young kids, even if they are at the age where medication might be helpful, a lot of the times parents are like very concerned about that. And so like, I think, some parents, they might be worried like, well, what if I like talk to my doctor and then they just want to put me on medication? It's like, that shouldn't be what happens. Like, you can discuss the options. Like, behavioral interventions are great. And like you were saying, there are like, I use them with kids who are super young. And it's super helpful for families, and even just like thinking about like first steps, like even if you can't get like a neurodevelopmental assessment right away because of I will say wait lists, most places are very long. While you're waiting, you can get these behavioral interventions, which could help any kid, even if they don't have a diagnosis.
Yep. I use them with my daughter all the time. These are behavioral principles that apply regardless, but they're even more necessary for children with ADHD. So almost think of it as prescriptive for them, but a nice thing to do, for kids who aren't really, dealing with ADHD. And a question kind of just came up, that can kids receive interventions without a diagnosis? So in terms of interventions specific to ADHD, like medications or things like that, it's going to require a diagnosis. But these behavioral interventions don't necessarily require any sort of diagnosis. You can get them earlier than receiving a diagnosis.
Yeah, and I would say that's definitely the case for a lot of the young kids that I work with, like when I'm working with parents of 2-year-olds and 3-year-olds. So absolutely. So thank you. We love ADHD parent. She's a good friend. So executive functioning, like a lot of parents, they ask me like, what can I do to help kids with executive functioning? Which I think is an interesting question, based on, well, like what I know about like the research with it. So what do you think about helping kids with executive functioning?
So the biggest thing that you can do to help with executive function is really to get more information about what type of executive function dysfunction is there going on. So, I do recommend an actual neuropsych, A, because I'm a neuropsychologist, and B, because you want to be able to tailor your recommendations and your interventions based upon areas of strength or weakness. So, for example, a lot of kids nowadays, they're offered a diagnosis based upon a parent and educator questionnaire that are filled out and returned to the pediatrician, which is fine. But it doesn't tell you about, well, it's actually their auditory processing that is really vulnerable, whereas their visual attention is actually quite good. It doesn't really talk about, the issues that they're having with the fluency of tasks. So not just accuracy, but speed. It's not talking about, organization and planning. And so I've got a nice little picture here that I'll hold up. So this
gosh, I'm horrible at that, the Ray.
Okay, so this is the Ray Ostrich complex figure task. And so this is like one of the oldest sort of out on neuropsych tests, it's been around forever. So the main thing, and again, this is a very complex sort of picture here, But the way that people approach this task is actually what tends to be scored. And I tend to score that more qualitatively because a lot of kids with ADHD, they'll focus on the little attention to detail sort of things, but they miss the overall gestalt of the picture, right? So you can't really draw a picture of the house if you're starting with the doorknob, right? You got to start with, the bigger picture. So when it comes to specific tips and tricks, the biggest thing is that you got to figure out what your school-based interventions are. And for a lot of kids with ADHD, that might be a 504 plan. That might be an IEP if there are other learning issues. And that's really going to be getting that ironed out is actually going to be huge. But it also extends beyond there. And I do find that a lot of kids do a really good job of holding it together at school. And then they might come home and kind of lose it, or they go to their after school program and they're kind of kicking back. And I want to kind of stress also that's relatively normal as well. And some of those behavioral interventions can be helpful with that, but also kind of giving them some time to decompress before placing additional demands. So not the sort of thing where you want to come home from school and up, you got to do your homework right away. That's probably not going to work for some kids. You have to give them a little time to let some steam off. Other things that I often suggest that are not accommodations in the classroom, because that's an entirely different talk.
Yeah.
But in terms of stuff at home, I like to do a lot of play-based learning, even for older kids. So a lot of kids with executive dysfunction and ADHD, they might have trouble with visual motor integration or visual spatial problem solving skills. So toys like, depending on age, again, and their interests, Lincoln Logs, Magnetiles, Legos, Duplex, those are all really great because it requires you to have some sort of planning and organizing and to be able to follow multi-step directions if you're working from like a booklet to recreate things. And they're fun for most kids. And it will also teach them some frustration tolerance as well with a supportive environment. If you're doing it with them, provides a great opportunity for, parents and kids to kind of work together. A lot of the kind of executive functioning games for kids. So like red light, green light, stop, freeze, dance, those sort of things are good for help teaching kind of self-regulation and kind of self-monitoring skills. So like the checking yourself to kind of make sure you're on the same wavelength as other people.
Yeah. I also love organizational skills and management training. That's a huge one for a lot of those executive functioning skills. But like, I think it's really important for parents to know that this is something that is definitely going to be like something that follows, kids. Like it's these skills like that you're talking, it is definitely like teaching, but it will not get rid of these difficulties.
No, it's something that you want to kind of teach the foundations through play, and then you have to actually get and translate that into specifics. So that comes down to like color coding binders for school, having, a designated place for your backpack, making sure that things are in the backpack the night before. And I've had some kids work with executive functioning coaches or ideally therapists or psychologists who also do executive functioning coaching for that purpose, because the organizational skills are actually really a lifelong skill. And that's something that with kids with ADHD, it's not necessarily something that happens organically. It really is a skill that you have to both teach, and then you have to keep practicing it. You have to keep using it. You really got to retrain the brain essentially to act in ways that it doesn't normally act.
And it's like they do teach some organizational skills in schools, but like for kids with ADHD, they definitely usually need much more. So, Dr. Jennica, you have been so amazing. So can you tell, everybody I will tag you, of course, who's watching the replay so they can find you. But if you want to share anything else about yourself, you have given us so much knowledge on executive functioning.
Yeah, no, thank you so much for having me. And for any of you moms out there or soon to be moms, I have a lot of content on my Instagram at Dr. Jennica, Jenicka, for how to prevent toddler tantrums and how to essentially get things started off right from infancy and beyond.
I love that. And that is something that is needed because there's so many people who follow me with really young kids. And like, even if your kid doesn't have ADHD, you can benefit from your content. So thank you so much for sharing that. So, well, thank you for joining us. I hope everybody has a good night and we will see you guys later.
All right. Take care. Thanks for having me. Bye-bye.
Thank you.